Okay, everybody. I'm so excited to introduce to you Dr. Marie Woerner. She is a physical therapist who I just met through the online world, actually, in kind of a roundabout way. Very cool to connect with her. She works with something that I have no idea about. No clue. It is dry needling. And so I'm so excited to bring her on as an expert in this area. And Marie, would you like to say hi real quick? Just a little hello? Wonderful. So let me just tell you guys a little bit about Marie. Marie graduated from the Texas Tech Health Science Center with her doctorate in physical therapy in 2008. After graduating, she landed in Fort Worth, Texas, and practiced at a busy outpatient orthopedic clinic. There she had the opportunity to treat everything from low back pain to turf toe, which I just love that. All right, after several years treating orthopedic patients, Marie transitioned into women's and men's health by completing an American Physical Therapy Association, and that's the APTA, their approved residency. So by the way, I just have to interject here. Marie is really well trained. This is somebody who knows her stuff. So upon completion of her residency, Marie was offered a clinical faculty position with the University of North Texas Health Science Center and developed the physical therapy pelvic health program for the university. So she's teaching the next generation of healers, which is fabulous. During her time at UNT, she was able to grow a thriving practice as well as obtain her board certification in women's health, making her one of the very few board certified specialists recognized by the APTA in Tarrant County. And I would say in the United States, not everyone is board certified and has gone through that training, so that's awesome. She also developed a strong interest in functional dry needling and obtained her certification through Kineticor. Marie has a passion for helping others, spreading the word about pelvic health, and strives to provide exceptional care to all her patients. And probably the most important part of this whole little introduction is that Marie is happily married with 2 children who she loves to spend time with. So that's such a wonderful way to end it. I love that you're a mom as well as a healer and healthcare provider. So Marie, thank you again for being here. And I want to get right into it and let you maybe start off with what is dry needling, kind of what's the definition, and what really sparked your interest in dry needling?
So I'll go first. I'll start with kind of where my interest sparked. Whenever I worked at an outpatient, I was doing outpatient ortho, and I had an interest in women's and just pelvic health. And my work actually sponsored me to go and shadow a clinician in that area. And so I went and shadowed this woman in Virginia, and she actually had the very first residency recognized by the APTA. And so I spent a week with her, and that was one thing that she told me. She was like, if you are able to dry needle in your state, it's awesome, and you need to look into it. And so from there, I just kind of always kept it in the back of my mind. And then when I was going through the residency at Baylor, they had offered some courses. And then whenever I went to UNT, they had started offering courses. And so pretty much like within 5 or 6 months of being at UNT, Kineticor came and taught their first course there. Not, just to be clear, not Kineticor's first course ever, but the first course that they taught at UNT.
Okay, perfect. And so before we get into what is dry needling, I want to clarify to everyone that it's not available, or actually I want you to clarify. When I left America, I live in Germany now. When I left America, it was not available for physical therapists to do in every single state. It was kind of a state-by-state basis. Is it still that way?
It is. It's honestly becoming more accepted, but there are some states that are having some issues. Washington is one of them. And New Jersey, they're also having some difficulty there. But it's becoming a lot more accepted, and more states are gaining the right to do that.
Okay, so what exactly is it? Is it like acupuncture?
Everyone asks that because everyone's heard of acupuncture. So functional dry needling you're using a filament-sized needle, and you actually are sticking it into muscle that has dysfunction, whether that be into an active trigger point or an area that you feel like is contributing to pain. And so the act of like the needle going in, there is a twitch response, which is almost kind of like a reset button between the muscle and the nerve, and gets that muscle to almost immediately relax, and you can palpate a difference in the tissue. And so it's always like followed up with some type of reinforcing activity, whether that be stretching or exercise or something to that effect. But I have found it in my patient population to be really effective, especially like with pelvic pain and pregnancy.
Wow. So how do you use it with pelvic pain? I know a lot of the people who watch my YouTube channel do suffer from pelvic tension and pain, sometimes painful sex, that kind of thing. How do you use it in clinic, and what results have you seen?
So one thing, whenever you have pelvic pain, there's lots of muscles that are involved. So it's not just pelvic floor. Yeah. It's one of those things where we're looking kind of at all the musculature that's in close proximity or that works with the pelvic floor. We look at the abdominals, the inner thighs, posterior pelvis, like all of those muscles, in addition to what's going on at the pelvic floor. A lot of times there's trigger points and there's a lot of muscle tension in those areas. And so I'll use dry needling to address the trigger points and everything at the muscles attaching. And then also with the pelvic floor, you can dry needle the pelvic floor. There are ways to be really effective with it. I don't do it with every single pain patient. It really depends on a lot of things, including anxiety, kind of just how I feel like the patient's going to perceive it, and if I feel like they're a good candidate. But the patients that I have done the dry needling with on the pelvic floor, it's been really effective. And in some cases, I've had patients where I felt like they would really benefit from a trigger point injection into the pelvic floor. I could feel like a palpable trigger point that just would not go away. And being able to use dry needling, I was able to address, and I'm not trying to compare it to trigger point injections because there's a time and place for everything. However, I found that with that patient, she got a lot of relief, and she didn't have to end up going to, a physician and having a trigger point injection in that area, which could have been, the cost of the surgery center and stuff like that. And so yeah, it's been really effective. But again, it's not with every single pain patient. It really depends on how they're presenting, and if I feel like they would be a good candidate or not.
Wow. So when you say accessing a person's pelvic floor, so that's going to be more of an internal access point, like vaginally for females, rectally for males? No.
Sure.
Yes.
So whenever you dry needle the pelvic floor, there's several layers. And so the superficial pelvic floor obviously would be those muscles are located under the external genitalia. And so be palpating specific muscles and then needling along that tissue.
Okay.
Then with the pelvic floor, I have them on their side, and then I have them pull a cheek up, whether they're male or female. And so, yes, technically we're getting an internal muscle, but we're accessing it externally, if that makes sense.
Okay,
so it's like in a side position, they pull the glute cheek up, and then I palpate areas that are tender.
Okay, that makes sense now. I was wondering how that would work. So, okay, fascinating. So what kind of exercises would you then follow up with? That's one of the things that makes me proud to have my background in physical therapy, is that we don't just apply a manual technique where our hands are on the patient. We also give follow-up stuff that the patient can then do themselves at home often. So what kind of follow-ups do you provide your patients with? I'm sure it depends on the patient, but...
It really depends, but since we're talking about pelvic pain, lots of relaxation strategies, stretching, especially to help elongate the pelvic floor. Also stretches just to address, decreased active range of motion in adductors and posterior pelvis. And then also a lot of times, I'll have them do relaxation of the pelvic floor by gently bearing down with proper breathing strategies to help elongate the pelvic floor if they can.
I love that, and I call it the pelvic drop. How do you describe the pelvic drop or the reverse Kegel, or there's different ways to describe it? How do you teach that to your patients? I'm curious. I'd love to hear your technique.
It is so different for every patient, but I do it with manual or tactile cues, and then a lot of verbal. So with a finger in, I have them take a nice deep breath, and then on the exhale to imagine like pushing my finger out or allowing the tissue to elongate. Sometimes I'll have them I'll be like, okay, take a nice deep breath in, and then on the exhale, use those lower abdominal muscles to really feel like you're pushing my finger out. I find that has been one of the better ones that I've gotten results with. Mm-hmm. But again, sometimes it just really depends on the patient, because again, not all fits one, you know?
Yeah, because I know that there's also the breathing technique where you can do the relaxation and the lowering on the inhale as everything expands in your belly and your pelvic floor, and then the exhale is a slight lift. So that would be kind of almost the opposite of what you're teaching, but I understand what you're saying. It's like different ways of kind of getting at it. It really depends on if the person understands that connection with the breath and the movement. Is that how you feel as well?
Exactly.
Yeah.
So a lot of times those patients, they do not have that connection. So those muscles are tight all the time. And so the ones that I'm cueing like with that type of cue, it's because those muscles are always tense no matter what they're doing with their breath. And even with them doing like deep diaphragmatic breathing, they're not able to get the excursion. And so it's almost kind of like an over-exaggerated relaxation or excursion of that muscle.
That makes complete sense. You just have to meet the person where they're at and be different for everyone. Oh, that's so cool. I'm learning things too. This is wonderful. I have a question. So in relation to pelvic pain, we've talked a little bit about how you can use this for pelvic pain. Can dry needling be used for any other conditions that are related to pelvic floor dysfunction, such as maybe prolapse or incontinence or anything else that we may typically see in clinic?
So in a roundabout way, so if a patient came in and her main concern was she's feeling heaviness, she sees something coming out, functional dry needling would probably not be the first thing that's going to come to my mind.
You're talking, just briefly, you're talking about prolapse. Like if something was coming out, if somebody was sort of feeling that heaviness, you're speaking to prolapse, right?
Right.
Yeah.
And so they just don't have, so what is going on is that they just don't have support to their pelvic organs, whether it be because their muscles are shortened or whether it be because their muscles are weak. And so a lot of symptoms that we can get, it does, if you have leakage or if you have prolapse, it doesn't necessarily mean that you just have a really weak pelvic, well, technically it's weak because a muscle that's non-relaxing is weak as well, but it's not necessarily because, I need to do Kegels or pelvic floor exercises. Sometimes the muscles just won't relax completely. And so they would have like a shortened pelvic floor. And so in those cases, they may benefit from dry needling, addressing any trigger points that are in muscles that are surrounding, maybe the transverse or the rectus or the adductors or the posterior pelvis. So they may be a good candidate for that, but it's just to improve like the coordination of the muscles with the pelvic floor to improve support.
Yes, that makes complete sense. So it's really not the treatment, it's kind of an adjunct treatment to support the main treatment that you're providing, which would be, some way to work on coordination and control of those muscles. Those support muscles, yeah. Okay. Yeah. Really, really cool. So this is something that can help a wide range of patients. Do you have any standout stories from anybody? Today I kind of wanted to focus mainly on pelvic pain. Do you have any particular stories that were really cool or aha moments with somebody who had pelvic pain?
That one patient that I was talking about who avoided getting the trigger point injection, she comes to mind. So she was probably I don't want to say older, but she was in her 50s, 60s. She had a rectocele repair, and after her repair, she had a lot of pain to the point that she couldn't lift a gallon of milk. She could barely do laundry. intercourse was completely out of the question. And she was also the caregiver to her husband who had COPD, and was pretty symptomatic.
Yeah.
And so this poor woman had, she had fecal incontinence after her rectal repair, in addition to just pain. And so she couldn't function. She couldn't take care of her husband. She couldn't go to the grocery store without having to sit down. And so when she had gone and saw another pelvic floor therapist in Fort Worth, and then from there, that provider sent her to me because I just had, I had a little bit, I don't want to say more experience, but I had a little bit more experience in that specific area.
Yeah.
And so I started seeing her. And after I went and learned how to dry needle the pelvic floor, like I had treated her a lot with just internal techniques to get the muscles to relax. But there was this one spot that felt like cement. And I could find it every single time. And I had actually sent her to a urogynecologist to see about getting a trigger point injection. And he had agreed, but then anyways, she just did not have the best of luck getting that procedure. And so whenever I learned how to dry needle the pelvic floor, she was the first one that I did it on, outside of class, of course. And she just had amazing results. It made a huge difference.
Yeah.
And I remember needling it thinking, oh my goodness, like it felt like cement.
Wow.
It was the craziest thing.
Now, when you learned dry needling, did you have to practice on each other? What I'm asking is, have you experienced this for yourself?
Yes. Yeah. Whenever you go to the class, at the time it was a 3-day class. Now they've done 3 and 2-day classes with Kineticore. I did a 3-day class, and I remember I was breastfeeding, and so I'd have to go out and like pump and stuff like that. But the last day, I remember getting my adductor needled and just losing it. I broke down into tears because my body was just so had that fight or flight, and I had been needled so many times that weekend. That doesn't typically happen. I'd probably been needled at least 100 times in that whole weekend. But yes, you definitely experience every muscle that I've ever needled myself. I've had the experience of being needled on me.
That is really nice. I mean, you have empathy for your patients. You know what they're going through. Now, that's fascinating that you had an emotional reaction with the adductors, because there's actually some, and that's the inner thigh muscles for anybody who's not familiar with that term. But there's so much interesting information out there about the psoas, the hip flexor area, the inner thigh area, and the pelvic area as being really an emotional center for a lot of people. It's kind of a different way of looking at things. It may not be one that you look at, Marie, but I've heard it said, and I believe it's true, that this is an area that houses emotions as well as physical tension and pain. It can hold emotional tension and pain too. So that's really interesting that you experienced that when you were already kind of overwhelmed. It sounds like you had a lot going on.
Yeah. Well, and honestly, whenever you're dealing with pelvic floor in general, I think that it's an emotional, there's just a lot that can be tied to it.
Yes.
Whether it be, just a traumatic delivery and pelvic floor pain and just any of that, I think can be very emotional. And so I definitely have my fair share of patients, and we're not just PTs at that point, we become their almost not a counselor, but almost kind of similar.
Yeah, it's wonderful. It's such a wonderful field, and we do, as physical therapists, we tend to have a little more time with our patients too than other providers might. And so it's nice, you really get to know the patients, and like you said, it is an emotional journey no matter what. There's a lot of stuff going on in this region, from sex to childbirth to, just all sorts of things that we deal with every day. So yeah, so cool that you have found this way of treating patients that's really working for you. I want to just kind of one more time kind of swing back around into the mechanics of actually how it does feel for a patient, and then I want you to tell me how someone would go about finding a provider in their area, or finding out if their state in the United States accepts it as a practice. So kind of what do patients feel? What would they expect with the procedure, and then how would they know where to find somebody to help?
So for me, whenever you get dry needled, the muscle a lot of times will twitch. That's called a twitch response. And we're actually like looking for that, and we're trying to elicit that in most cases. I don't want to say in most, but in a lot of cases, whenever you're trying to address a trigger point. And so some people have described it as cramping. To me, it feels like a twitch. Like it's just an unfamiliar sensation. A lot of people ask, is it painful? And to me, it's kind of like, it's not painful. It's just an unfamiliar sensation. Mm-hmm. And so, cramping or a twitch, or like the muscle just lifts or activates, or I guess that's how I would describe like what you would feel during. And then after, it's really common to feel sore, like muscle sore, like you went to the gym and did a really heavy workout. That's typically how you feel after.
And how long is the needle actually in the area? How long does it remain in the area?
Sometimes when it's honestly pretty quick. And so whenever you're like addressing like a trigger point, like you insert the needle and you're trying to elicit a twitch response. And so you may like piston the needle like a couple times to get that response.
So that would be like an in, out.
But very quick.
Okay.
Yeah. And then other times, right whenever you insert the needle, it'll twitch. And so a lot of sometimes people will just take the needles out right then. Sometimes people leave those in and apply something called E-stim, like to the needle, to get it to just twitch a little bit more, and that can help with some soreness as well. And so it kind of depends on the technique that the provider is using, but it's not going to stay in like minutes.
Okay. That's what I was wondering, is if you lie there for a long time with the needle in your trigger point, but it sounds like it's really fairly quick. So
yeah, it is.
Okay, great. And that allows time then for that follow-up, the stretching or the strengthening, whatever is important for the patient. So how could somebody find somebody in their area? Is there a listserv or some kind of search tool?
I was certified through Kineticore, and they have a really great website that if you go on there, you can find a therapist tab. And so you can, that's probably what I would do. Like if I was looking for someone, I would probably go, other than going through their classes, like I'm not affiliated with Kineticore at any point. But I think that it's a great program, and I felt like they were really thorough. And so I would trust anyone who's gone through their education. Not saying that others is not good, but I just, that's probably where I would look.
Okay.
To find someone.
Okay, that's great. I'll find that link and I'll put it in the video notes or the video description below. So if anyone is interested, I'll link to that. And I'll also, of course, link to your information as well, Marie. So is there anything you want to leave us with before we wrap up?
I think that kind of covers it.
Yeah, that was wonderful.
If there's anything you don't feel like we covered well.
No, I think you did a wonderful job. I mean, you explained it very clearly, and I think it sounds really fascinating. I'm almost ashamed that I don't know more about it, but then again, I've been away for a long time, and it is a fairly new, I believe it's fairly new to the United States at least, and the field of physical therapy, so.
It's definitely becoming more popular. It's actually been around for quite a while, but especially in Europe. But then here, I think it was popular for a little bit and then kind of phased out, but then it's coming back. And they're doing more and more research on it now. And so I think that's probably why it's starting to come back, just because they found such great benefits with all the research that they're doing.
That's wonderful. So cool. Well, thank you again, Marie. How can people get in touch with you if they have specific questions for you or want to find out about your clinic if they live in Texas?
They can go to, so my website is ptmarie.com or Woerner Physical Therapy, and that's Woerner Physical Therapy, And then my email is actually listed on my website. And so if they have specific questions about it, they can feel free to email me or give me a call at my clinic. It's easier to email though if you have specific questions.
Yeah, agreed. Yeah, I love email. So, okay, I'll put those links as well in the video description, the notes below the video. So definitely check those out if you are interested in this. I think it's so cool. And again, thank you, Marie, for being on. I really appreciate it. And I hope we can stay connected. So I'll see you later, and goodbye to everybody else. Bye.